All right, so today is incredibly exciting because we're going to go through the first interactive tool that we have on the website, and that's called the What's Next. What I want you to think about is to frame this out. You have someone, or you yourself are in the hospital, or you are on one of the levels of care, like you're at a skilled nursing facility, maybe you're in an inpatient rehab, maybe you're getting ready to discharge home. This interactive tool allows you to put in what some of your medical criteria is that you're currently experiencing, and then give you a couple options to do further research on to see what's a good fit. So when we see here along the top, we're now in our Find Your Care. And what we're going to do is select what are some things that you may or may not be experiencing. So let's say you are in the hospital and now you're going to discharge home with a wound vac, which is a device that goes over a very deep, severe wound that helps pull out the infection and help your skin heal faster. Maybe you require a specialty bed because of the placement of that wound. And maybe you're also requiring IV antibiotics. So here we'll select those three pieces because that's what you're currently experiencing. Click continue. And then these are more questions to really hone down what are some options that you can start to research. So is your loved one currently participating in structured therapy, or is care limited to the bedside nurse? So let's say some therapy but less than 1 hour. What is the primary reason for hospitalization? Just pick the closest one. It doesn't have to be. Just because we did initiate this with wound, we can say wound healing. And then where were you before the hospital? Were you at home, fully independent? Were you home with some help? So did you need significant hands-on? So we can just say needed some help with medications and transportation. When your loved one is eventually ready to leave the next level of care, like what's the most realistic? Is it possible for them to go home, or for you to go home, whomever you're doing this for? So let's say going home, whether it's safe or uncertain, because we do have folks who make those choices. Then click see your results. And what this does is it's going to give you an idea. Again, this is a place for you to start your research to understand it. So what is it? Skilled nursing facility is a licensed facility by the state to provide care. Short term, not long term, 20 to 60 days, but skilled nursing facilities do have a section where you can stay long term if that is required. Also a note about what does that Medicare coverage look like? And then again, back to the questions. Ask the care team all of the questions that you need to. And then in addition to that, we also have the link where we can find the nursing facilities that are near you. And this is based off of the Medicare website, so it'll automatically come. Let's say you're in Portland, Oregon. You just want to search. So this is going to help you come up to where you can find the facilities that meet your care needs. And then that's where we're at. So then we can just click start over and it'll bring you back to this. So let's go through one more. So let's say you had respiratory failure and you required a ventilator. Maybe you had a tracheostomy, you were on tube feeds. Which tube feeds are when the liquid feeds you either through your nose or through a special port in your stomach. So again, a question about therapy, because how much therapy you can tolerate really go through and indicate like where you can go. So no structured therapy, medically complex. Again, just pick the one that's closest: heart attack, stroke, sepsis, or serious infection. Again, just as an example, let's say fully independent prior to coming in. And realistically, what are we looking at this point? So if you've had that significant of a hospital stay, it may be a little bit longer. But let's say going home with a caregiver. So again, this gave us two options, so two different levels of care. Your long-term acute care hospital, same structure. What is it? Typical length of stay. What does the coverage look like? Questions for your care team, because remember, your advocacy is strongly rooted in the questions that you ask to help your understanding. This one also populated SNF. So this is an educational interactive tool for you to get guidance to be the foundation of your research to see what's best for you and then also best for your loved one. Over, and then if you have questions about those levels of care, types of care, you can then take, like let's see on our last one, it said LTAC. We then can come to the types of care section, which is the previous tab we covered. And then we can learn more about what an LTAC is here and what we would expect. So each tab builds on each other. I hope this helps, but that's one of our first interactive tools that help you find the care that you need, what's going to be best to meet your needs to make sure that you have the best outcome possible.